Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're covering cardiovascular health for American Heart Month. Next, we'll be discussing how to navigate the daunting task of Medicare planning and enrollment. Finally, we're talking dementia resources and what to do when you or a loved one receives a dementia diagnosis. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. February is recognized as American Heart Month, a time dedicated to raising awareness about heart disease and promoting cardiovascular health. Here to talk to us more about heart health is Dr. James Lonquist, a cardiothoracic surgeon with the Baptist Heart Vascular Institute. Thank you for joining me today.
Hi, Emily. Pleasure to be here.
So first of all, what causes a heart attack?
So heart attacks occur when the heart muscle does not get a good blood flow. So we all have arteries that supply blood to the heart muscle. When those block, that's when the heart muscle starts to die. And it's very time dependent. So we say that after about 6 hours, there is some degree of permanent heart damage. So the clock's ticking when heart attacks start. Usually it happens from plaques or hardening of the arteries. And then there's a blood clot that develops in one of the blockages, and that's when the blood flow to that portion of the heart stops.
So what are the preventative therapies for coronary artery disease?
Yeah, so coronary artery disease is exactly what I just described, where there's hardening of the arteries and plaques gradually build up within the arteries. So I talk to my patients about the 6 main risk factors. So some you can't change. So if a patient has a very strong family history of heart disease, and we define that as someone in your family under the age of 60 had something like a heart attack or needed a bypass operation or stents, that's a risk factor.
Sure.
Can't change that. Men have a higher risk than women. Can't change that. Men as we age have a higher risk factor. So none of that can be changed. What we can change are the other risk factors. And I push my patients pretty hard to do this for each of these. So high blood pressure is one of them. So for patients that can have good control of their blood pressure, they have lowered their risk of heart disease. Same thing with diabetes. If they're diabetic, keeping the blood sugars under control lowers their risk. Same with cholesterol and lipids. And then the tough one is the smoking. So I think of all the things I've just described, that's probably the most important. If I can get my patients to quit smoking, it really goes a long way to minimize their future risk. Not all patients can do it, but I push all of them, no matter what age they are, to try to accomplish that. So on top of all that, there are lifestyle changes. One is exercise. We still say 150 minutes per week of moderate exercise, and that's not lifting weights. It's usually walking or swimming or bicycling. Those are the most healthy for the heart, aerobic exercises. To the extent that you can lower stress, easier said than done. We do think that's a useful adjunct. And then dietary changes. So despite the new food pyramids that are out there, we still say diets that are low in saturated fats are the healthiest. So fruits, vegetables, whole grains, very good. Fried foods, not as good. Fish and chicken, much better than red meats. So those are the general guidelines that we give patients.
Gotcha. So what should a patient do if they're experiencing signs or symptoms of a heart attack?
So the important signs and symptoms, they are usually dramatic, but not always. So chest or back pain, or pain that radiates to the jaw, or pain that goes down the arm. So those are the ones that we need to worry about. So when it happens, call 911. If you're in the car and you can get to the hospital faster than the ambulance, well, that's an option too. The other thing we still recommend is to take 1 adult aspirin and chew it, the non-coated aspirin. If you happen to be a heart patient and you already have been prescribed nitroglycerin, that's also something that can be utilized. But as I alluded to before, the clock's ticking. So it really matters. We really try to get treatment started within 90 minutes of the onset of chest pain, and that's been shown to have much better outcomes than patients that try to tough it out and wait a number of hours, or worse yet, a day, because that's when a heart attack can already be completed. We don't have the advantage of saving that heart muscle.
And a lot of people, I guess, think maybe they're overreacting or they're not sure. They were in a little bit of denial maybe, so that might be a reason someone's putting it off and not going immediately or calling 911.
That is true, and chest pain can masquerade as a lot of different things. Heartburn is a typical one that patients will come and say, I thought it was just heartburn for all these months, and it turned out to be the heart itself. So keep in mind that if it's getting your attention for pain, then it needs to be evaluated.
Okay. So what are the treatments for heart attacks or coronary artery disease?
So there are three main treatments: medicines, stents, and surgery. In addition to all the things we just talked about, trying to limit the risk factors. So sometimes medicines are good enough to control symptoms. Typical symptoms that bother patients are chest pain and shortness of breath. If you've had a heart attack, you can have the shortness of breath that's persistent, but chest pain usually means there's still heart muscle that's starving for new blood flow. So if the blockages in the arteries are minor, we usually start with medications. If a patient is at the hospital for a more dramatic event, usually there's a tighter blockage. So anything more than, say, a 70% blockage in the artery, we consider to be significant. So the second stage is to use a stent. So stents are wire mesh collapsible tubes that are threaded into the heart. So for instance, you've got an artery here, there's a blockage here, the stent goes through into the artery and a balloon is used to expand it, and it props open the artery where the narrowing was. That works very well for blockages that are in one or two of the arteries, particularly ones that are not at branch points or other complicated places in the heart. If a patient has one of those complicated locations or three or more blockages, we're usually talking about bypass surgery. So that does have the best long-term results, but it's also the biggest operation that we do. And so we usually reserve that as either the last alternative or if you're in one of these other categories.
Are there any new treatments for congestive heart failure?
So there are. So congestive heart failure is very common in this country. There are many well-established classes of medications to help patients. There are also several new classes of medications. And perhaps the most important or the most exciting new treatment that we have over the past year is called the Barostim. So we're proud at Baptist to be the first in the area to offer that. That's a device that is inserted right on top of the artery in the neck through an incision about that big. The electrode is placed there. There's a little cable that runs down to a device that's implanted under the chest, similar to a pacemaker. Mm-hmm. So it's a very interesting new idea. The receptor on this artery in the neck, called the carotid body, responds to electrical impulses, and that's what this generator is designed to deliver. So it can lower heart rates, it can lower blood pressures, and it works through hormones. So once that's stimulated in the body, the hormones are secreted, and patients have had remarkably good results. That is not a first-line therapy. That is usually a therapy for patients that have failed the best that medicines have to offer. But patients are having remarkably good results. We're excited to be able to offer that.
Awesome. Well, Baptist on the cutting edge of heart surgery options here. That's awesome. Well, thank you for joining me today and sharing this with us.
Indeed. Pleasure to be here. So.
Stay with us. We're diving into Medicare research and planning coming up.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You could even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
If you're reaching the age of Medicare eligibility, you're facing the daunting task of researching and enrolling in the right plan for you. This process can be overwhelming, so we've got Ervin Byrd with Baybridge Insurance and Financial Solutions joining us to explain what you need to know as you navigate this topic. Thanks for joining me today.
Thank you, and thanks for having me.
So first of all, tell me a little bit about what you do and your role.
Okay, so I am a licensed health with the agency, a health insurance agent. I also do some life products, but primarily I'm with the agency for health insurance, a licensed agent. That's important because the state of Florida requires that we are. And as an agent, I always share I'm an educator first. So while I am a sales agent, I really like spending time with my clients to educate them on what the products that they're getting, because there's a lot happening around Medicare and health insurance.
Absolutely, yeah. and it's really complicated to navigate.
Yes.
I understand. So what do you see in your work are the major needs that are facing seniors that are at this point in their life?
So at this particular juncture, what happens when seniors or people are moving from under 65 to Medicare, it's just a lot of information. The audience may recognize that at 64, your email started to fill up, you get phone calls, the mail comes saying, join my company, come see what we're offering with all the major carriers. What I like to do is provide the information to say, let's just stop because it's overwhelming. And I've had clients say, it's just too much every day. And so the big part really is what do I need to know in order to make this happen? It is important to say that when you turn 65, every person in the U.S., when you turn 65, you automatically get Part A. Part A in Medicare is the hospitalization. So every person gets it. But what is Medicare? It is the federal government's insurance for seniors. That's what it is, Part A. The other part is that many people don't know that you have to apply for Part B. In order to have it, you are automatically qualified for Part A. You have to apply for Part B. So, and we can talk more about that in a little bit. But that's the biggest part is just getting through the information. And and sometimes your time to apply will sneak up on you, and you go, oh, I had one gentleman. His birthday was in like 5 days. He hadn't done anything. So we were 8 weeks into, yeah.
So as people start to near age 65, how should they think about planning and how soon do they need to start that process of researching and getting enrolled?
So the very first time a person is eligible, when you're eligible, there's this thing called initial enrollment period. And that's a 7-month window that you may apply 3 months before your birthday, the month of your birthday, and 3 months after. And so you should begin really, searching, researching, finding out what's available, what plans are available, and it's a process. And then if you are having difficulty, if you don't have somebody in your family to help you, then I would reach out to an agent that perhaps you may trust, or you may know somebody, or look for recommendations. It's important to do that because there's only one initial period. And then if you don't apply in your initial period, there may be some penalties with regards to the pharmaceutical or the drug plan. So
tell me a little bit about Medicare Advantage. Where does that fit into all this?
So the original Medicare, this is a great question. Original Medicare Parts A and B is what the government provides. Medicare Advantage is the government went to insurance companies and said, we don't want to be in the insurance business. So we're going to pay you to manage the health care for us regarding seniors. And so Medicare Advantage was a plan that will help with expenses that the original Medicare may not cover. And Medicare Advantage also has what we call the drug plan or pharmacy program connected to it. There's also Medigap that people don't talk a lot about. It's called Medigap or supplement. So it is, the difference there is it's a broader network. You can take that anywhere there's Medicare. So that's a big difference. You would have to purchase a separate pharmaceutical plan or drug plan with the Medigap plan. I've been encouraging my clients to really look into the supplement plans because the Medicare Advantage has some limitations in terms of coverage and in terms of network. And we've noticed here recently, even some of those services have been removed from Medicare Advantage.
So it's always kind of changing. And
Yes.
It is so much to navigate.
Yeah.
For those who are enrolling for the first time in Medicare, how is the experience different than enrolling in private insurance?
So the difference with private insurance is that first of all, many people have private insurance, or if you're employed, you have the insurance with your employer. So with the subsidies or the Affordable Care Act, people who don't have employers or can't get insurance, you can apply through the marketplace. We call it healthcare.gov. You can apply there. There are subsidies available. And so that's just you being online and being able to do that. Medicare is different in that it is primarily solely for seniors, 65, and for those younger than 65 if they're having some kind of major disability, I think it's called final or renal disease, that you just simply cannot provide for yourself. So certain diseases would allow for you to do that. Yeah, so.
Is there an open enrollment period?
Oh, absolutely. So there's open enrollment every year. October, I wrote it down because I should know this by heart. I get these dates mixed up. So the annual enrollment for Medicare is October 15th through December 7th, that we get that done. Then we come back to January. If you have a plan, you are able to change your plan January 1st through March 31st. So those are open enrollments, it ends there. But the initial is really, really critical if you're turning 65, and that is you are eligible to enroll at any time during that 7-month period. And then there's also a special enrollment. If you had changes, you moved, or if you had a baby, I can't imagine having babies at 65, but that happens. Nothing is down. There are changes certain things that allow you to do that.
Gotcha. And finally, how can individuals receive free, non-biased counseling about Medicare?
That's a tough one, yet doable. I would ask for recommendations from my friends, people who already have had experiences. And so I just got a call yesterday that one of my clients referred one of their friends to me. So I think that's probably the best way. That and good old Google search. You can, kind of get your first information. Be really wary of anybody saying, you got to sign today, or we got the best plans. It's just it's true. So yeah, I would rely on recommendations, referrals from friends.
Excellent. And then you can find what's
best for you. Yeah, and ask questions. Yeah.
Absolutely. Well, thank you for joining me today.
It is my pleasure. Thanks for having me.
Up next, we're discussing dementia resources and research. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
It's important to get a flu shot. each and every year because flu viruses are constantly changing and immunity from the vaccine decreases over time. Flu vaccines are updated annually to work against that year's viruses. The best time to get your shot is in the fall, but getting it later can still help. Getting a flu shot lowers your risk of getting sick, and if you do happen to get flu, it's likely to be less severe.
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
For many seniors and caregivers, dementia or diminishing cognitive function is a looming concern. Seniors dealing with memory loss or similar symptoms might not know where to turn or what help is available. Leslie Provis from the Memory Disorder Clinic is here to talk to us about this issue and how to approach diagnosis and care planning for this complicated topic. Thanks for being here, Leslie.
I'm grateful to be here.
So first of all, tell us a little bit about the Memory Disorder Clinic and your role there.
Well, I'm the social worker at the Memory Disorder Clinic, and we are next to West Florida Hospital. We're in the medical center clinic, and I get to work with new patients and their caregivers, and I've been there for about 3.5 years now.
Excellent. So what does that evaluation process look like if someone's coming in for that initial appointment to do a screening or an evaluation?
Well, once we have them in there, we actually speak with the person to see what their concerns are, what they have noticed, and also their family members. And we want to know, are they capable of doing their activities of daily living, bathing, grooming themselves? Can they use the microwave, the stove? How much help do they need? And then the tests that they get an MRI, an EEG, and the basic lab works, and additional neuropsych tests. And all those tests together are going to help to rule out if there's an underlying physical condition or is it in fact a type of dementia.
Gotcha. What are some of the other resources or support that the Memory Disorder Clinic offers?
One of the things that I also get to do is go out and do education. I do training and presentations to other caregivers. I provide support groups and work closely with you guys at the retreat. We send people over there, do the referrals to there, and there's a new place, First United Methodist Church Respite Center. So there are a bunch of other support groups that we do have in the area. So also just providing overall education. We have education packets, how to communicate with your loved one, and just learn to work better with them.
Absolutely. And we love working with you at the various Dementia Education Forum, and we love all you do for us. What are some of the early signs or symptoms that people or caregivers can look out for that someone might need that screening for dementia?
Word-finding issues, we all have them, but they struggle. They really don't know, they've forgotten what the word is, and they will try to word substitute, repeating questions, repeating conversations, forgetting where your glasses are, your keys. We all do that to a certain extent, but it's more so, it's more frequent, it's noticeable. It's really noticeable.
And when it starts affecting your daily life and interrupting your daily life.
Absolutely.
So I understand individuals with Alzheimer's disease or related dementias can sometimes be in denial about the situation. Maybe they don't want to admit there's something going on with their mind. What advice would you give to caregivers or family members about how to approach that topic if they're seeing something, but maybe the person in question isn't asking for help and is maybe trying to hide it a little bit?
I would encourage them to, let's go rule it out. Let's go, maybe it's something, it is a physical condition. Let's just go ahead and do these tests. We'll go together and we'll just go from there. But yeah, that's scary. I can't imagine, having memory issues.
Yeah, and a lot of the testing is about kind of ruling out different things that it might be other than a dementia, or kind of honing in on what type of dementia it is, because there's so many different types, right?
Correct.
So what are some other tips or resources you'd suggest for caregivers of somebody who does have dementia?
Be patient. Keep good eye contact. They need things written down. If they need pictures, images, I mean, it's a learning process because the disease changes. So you've got to learn with them, and that's not easy. But I think the most important thing is to be patient, and because the second most important thing is to ask for help so that they're not alone, because it is a very debilitating disease, and it's really, really hard on the caregiver as well.
Absolutely. I've seen it myself and my family. The burden of caregiving is so great that these support groups, the respite, are so important.
Mm-hmm.
So can you tell us what's new in dementia care research?
Can't answer specifics, but I know that there's the medications that are out there currently help to slow the progression of only 2 types of dementias that I'm aware of, which is Alzheimer's and dementia with Lewy bodies. And those are for early onset. Mm-hmm. Once they, get into later stages, those medications are no longer helpful. There are now infusions available. There are genetic testing that can be done. I don't know what else is in the pipeline right now, though.
And what are some of the big resources you point people toward if they're a caregiver of someone with dementia in our area?
In our area, well, again, we've got the Respite for All. We've got other caregiver support groups in the areas. I do have a list of those. Alzheimer's Association is big, and they actually have that 24-hour call line that I wasn't aware of until Ms. Tina Henson talked about that, where you can call at any time.
Yeah, if you're in crisis in the middle of the night,
it's pretty
deal with the issue that's coming up with your loved one, you can call that.
It's amazing. Yeah. So that's something else. Yeah, 24 hours for sure.
Absolutely. Wow, thank you so much for sharing this with us and being here today.
Thank you for having me.
And thank you for watching. Until next time, enjoy life. You've earned it.